It is my pleasure to introduce our next speaker, Dr. Nitchakorn Tangsathapornpanich from MIT. And in her presentation today, she's going to talk about the workplace team approach to increase engagement in digital health wellness solutions. So Nitchi is really a systems thinker, and I think you're going to see a contrast to what we just heard in terms of the area of focus. And I'm really excited to have her share with you all the work that she's been doing. So I will stop sharing and transition over.
Thank you so much, Amy. Good afternoon, everyone. Thank you so much for attending this session. This is the topic around workplace team approach to increase engagement in digital health wellness solution. So in this picture, cover picture, in the middle of the picture is me. We were working on the drilling, emergency drilling. If there is a case of accident, we have to prepare how to use the stretcher and bring the injured person to the safest site. So just a little bit of context why we are talking about oil and gas. Oil and gas industry support around 9.8 million jobs in the US employment market. However, in the fatal work injuries, it seems not a lot. It's the lowest rank among every industries. But when we look at the rate, which is the number of fatal injuries to the total workers, it's become on the second rank despite a lot of safety measures. And this is another news to show that offshore worker fatality rate are 7 times higher than US average. And that's bring to our talk. So that's how the oil and gas industry was structured in different way than typical office worker. So today's scope, we will focus on occupational health nurse and doctor, and also health and safety committee, and also how we could create co-creation the solution for them. So a little bit about me. The work that I just did before coming to MIT is I'm an offshore doctor working in offshore drilling platform for 1.5 years. Before that, I was primary care doctor and also the facilitation and trainer. I chose to come to system design management program at MIT because I realized that in order to make people healthier, I could not just be doctor. How could I scale up my work? I tried to do health prevention at my work site, but it could not seem to be able to scale without more knowledge. And that's bring into the topic that I'm trying to demonstrate today. So this is usually how I should not generalize, but as a healthcare worker, when we look at one person, especially the person in my responsibilities, we will see, okay, what is their work scope? What is their age? What is their health behavior? So I represented with BMI and smoking history throughout this presentation. So let's start with doctor and nurse. So they have 4 scope of work. First is medical care. It usually just acute and emergency and basic care. Second is occupational health. This is a very important scope for us. We do fit to work examination, drug test, hearing consultation. If we realize that our worker from annual examination have the drop in hearing, we have to evaluate and shift the work environment for them to be away until their hearing is getting better, and also examine the toxicology, how they wear the PPE. If they have like a mercury or lead increasing in their blood or their urine, we have to let them step away from their current work. And as an emergency response plan, as you see in the cover photo. So all of that, the health promotion are very little part of our day-to-day work. We might have just weekly health talk or monthly week talk, and the poster and rally. So this is the main area that I would like to draw the attention to, because we want to do health promotion so much, but we don't have the resources to scale it and to make it better for every employee that we have. So this is just the photo when I was at offshore platform. We travel with helicopter and boat, and the bottom right is just we always be as a team engaging in every activities. And the second part is health and safety committee. This is a very important part that we use to engage every workers. So it consists of top leader like CEO or site manager, where safety officer is a secretary to make sure that every issue that has been addressed in the meeting has been solved. So this kind of committee is an official role that some of the state has demand for employee to have issues for the top manager to hear the real voice from the lowest ranked workers. The issue could be many things for the well-established health committee that the safety standards are already achieved. It could be something in day-to-day life, right? Safety boots are not working well. We need new vendor. The snack at the break is too oily, or there are not enough of exercise equipment during the peak time. This is a very good stage that we could discuss how could we make the health environment for the whole site better, because each department sends some of their representatives, and they are not supervisors, they are ground worker, frontline worker that really bring the voice of everybody to the stage. So this is just a law. So in the US, it's not required by every state. Only some states require to have the safety committee. So this is the inspiration why I want to have this talk, because we usually develop the digital health application that focus on office worker, and we reach out to HR, and they reach out to their people with town hall or email, but which is challenging. The engagement rate has been challenging, but if we shift an attention to manufacturing side, they usually have the structure that engage every employee already, which are usually the health and safety committee. Is not well established every site, but if we could encourage every site to have it, that would be really great way to engage and let them feel like they have the participatory, they have the voice in the workplace. And also the safety monthly meeting. In my workplace, we have safety monthly meeting, which have safety supervisor and doctor along with all the employee in that department, and we talk about safety and health every month. So this is just to give the full picture. How was it like in organization chart of the site? Usually there will be a site of field manager that is the biggest person that everybody has to listen to, and there will be superintendent or assistant manager, and there will be many supervisor and engineer over there. As you can see, the safety supervisor and doctor are hanging around, just report directly to site manager. This is just to emphasize that how much they emphasize on the safety and health. As for the HR, they are only at the headquarters. They send an email, they have a video call, but it's hard to engage from the distance. So they are the group of person that has the less engagement in our work site. As for the health and safety committee, everybody are at the same. So whether you are technician, you are supervisor, you have the same voice. And the biggest person there is just have to sit there to make sure that every issue addressed has been solved and move forward. So this brings to the last part here is about co-creation. A lot of the time, the discussion of digital health application focusing on product design. How could we design the product that people love? But if you're working with this occupational health doctor and nurses, we see it as service design. We already have our existing service. In order to improve, especially individual care, we digital health, if they position themselves as service design, tailor their application, their service for each workplace, that would help a lot. This is a very important campaign that was launched by National Institute of Safety and Health. So it's called Total Worker Health. It's something that occupational health specialists try to follow, which first of all, we need to eliminate unsafe working condition and substitute with health enhancing policies and better work condition, and redesign all the, whether it's going to be canteen, it's going to be work site, it's going to be the noise level. Try to make the workplace as safe and as healthy as possible, and then we educate our employee. However, at the last stage, the encouragement for personal change, we could do it as a whole, but if we get the digital health application, vendor comes to health and really talk to us, understand us, it would be a game changer. So this is just a picture of control room. So this is just a fictional persona to just give a glimpse of how was it like as a worker in that site. So the main problem we have is obesity, and the main reason is also a big problem. Rather, apart from the food, is also that shift work. They have to change the shift every 2 weeks. We know that they have the pre-diabetes. We have annual examination every year, but because of the shift, it's really hard to change. And when he has been diagnosed with diabetes, finally we have so little that we could do because he still have to continuous have work in the shift. And this is the team lead. This is another common problem. He's a very loving guy for everybody because he loves to cook and give the food to everybody. But as his identity is also harm him a bit in the way that it prevent him to become a healthier person. And this is safety supervisor. Smoking is very common. Even though he has a very healthy lifestyle, there is one thing that might be harder for him, but we are not there to judge. Everybody has the right to choose their health behavior, but it's just to give the landscape. How could we help as a work site? And field manager, of course, it's not every field manager would like all the staff to be healthier and happier, but as my experience, normally everybody try to make it happen. So just to leave you with something that I think it would be very fun and challenging from imagine myself before I come into the occupational health field. I don't know this. I don't know that how much the workplace is so meaningful to their health behavior. Is at least 10 hours of their work day, 5 days a week. So it's hard to quit smoking. It's hard to change the food, the nutrition. So if we can redesign and co-creation to make it better as a whole, not just for the framework of the workplace, but also assisting at the individual level, that would be great. This is just a sneak peek of the my thesis around employer health system. If anybody interested in designing the whole system, I would be really glad to talk to you more after this. So more information. This is a very big topic. If you're interested to engage the company apart from the HR side, looking at the NIOSH and total worker health would be a very good start. And also attend the conference, whether it's going to be occupational health conference or occupational health nurse conference, and also webinar. And the official term for health and safety team committee is Joint Health and Safety Committee, and you can find many information on the internet. So thank you for your attention.